struck me soon as I came to work here. Immediately there is a different feeling about the Alfred, I have to say. The number of clinical experts I'd heard about, just all around me, I was like blown away.
I've been here for quite some time now, for about a bit over 15 years, so obviously something keeps bringing me back every single day. I really love the challenge of my job. No day is the same, and there's always something different, something new. I get to work across a really broad variety of areas.
There really is a sense of striving for excellence. I really felt like people were really passionate here about wanting to do their absolute best.
You don't feel alone. We can all come together as a big team, doctors and allied health, nursing and everyone.
We're really fortunate to have great access to a lot of specialists. So we work closely with orthopaedics, plastic surgeons, with burns. It is certainly a unique component to working here. You do become specialised in certain areas, and I think that allows you to really deeply engage knowledge into those areas. And I think you really feel valued by, medical staff. You work quite closely. You don't feel like there's a hierarchy.
I work in ICU but also work across the cardiothoracic wards and the heart failure area. They are just extremely welcoming, very inclusive. There was some amazing innovative work being done when I arrived, and now the allied health team has just really exploded. I mean, I've been here more than 20 years, but I've really noticed over the last sort of 5 to 10 years just how much that's really grown as a multidisciplinary team. There is a really strong culture at the Alfred, particularly down the research area, really sort of cutting edge opportunities, and that's really shared quite broadly. There's a small project grant every year, we have fellowships, and for people who are just starting, what we usually do is, if they've got an interest, get them involved in a way where they might just be helping with some data collection. That really sort of sets you up if you want to go on and do, say, a master's or a PhD if you are heading down that field.
I actually started as quite a junior staff member here, so I've certainly had opportunity to grow, progressing through different grade levels within allied health. I've been well supported to take on leadership courses. There's a lot of secondment opportunities that come up within allied health, so I think that's really good. So I think that there's certainly opportunity to grow, and I think you're well supported, particularly if you do come in as a junior staff member.
There is multiple layers, particularly of education. We have a really good clinical supervision program that's really individualised to the person that's coming in to meet their needs and make sure that they're growing. Having undertaken my PhD in ICU with one of the main medical leads in that area, that really helped establish my expertise, gave me a voice, I think. Not only can I really approach any of the consultants in the unit about concerns or direction that we're going about a team, that they're happy to have my opinion.
I work with the vascular team and go on ward rounds with them. We've got such a good rapport that they very much will be like, okay, Lucy, what should we be doing now? In terms of what dressings they would recommend, where we're going to follow them up after the patient goes home. I think they really rely on us for that, and I think it's a really good thing, and I think it's brilliant for the patients as well.
When we're working with patients that have spinal fractures, we look closely at the referral, we review the imaging ourselves, we make decisions based on not just the referral but what we feel is best for the patient. What's been lovely is that the relationship that we've built up with both the neurosurgeons, the orthopaedic surgeons, they really trust our opinion on these things, and I just think that's such a great sign of the trust that they have in us.
I think that our complexity of patients is really interesting, but also then we work together so well as a team that it feels like you're achieving something. You're going home at the end of the day feeling really happy that you've helped.
Lucy and I are always having fun,
Yeah.
I think you have to have fun, and I think our patients see, and we brighten their days. Sometimes they might be lonely, they might be quite isolated, often they have quite challenging social backgrounds. I dare say some patients actually enjoy that when they come back as an outpatient to our total contact casting clinics. I think it is a bit of fun there.
Yes, exactly.
I don't think I've worked anywhere where there's such an opportunity for growth and so much variety. You can go in so many different directions, and there are multiple opportunities that come up all the time. You're going to have people to role model that hopefully will inspire you. I can't believe how much I've gained from working in this organisation. Speaking nationally, internationally, I would never have thought that would be possible for me, writing book chapters and doing a PhD and working with the most incredible clinicians. I'd read in books and I'm like, oh my goodness, I'm standing next to that person in the unit and they're teaching me stuff on a ward round. What a privilege to work with these incredible staff members. It's a hotbed of amazing talent, really supportive and welcoming, and you can pretty much do anything.